Hello, I'm Laura Santana. I'm a researcher from the University of São Paulo in Brazil. And first of all, I would like to thank you for taking the time to see this presentation where we're going to share with you the results of a research around the public policies and open educational resources in Latin America. Specific case study from the Pan American Health Organization network of OER repositories. Please feel free to contact me at this email if you have any questions, any doubts, or would like to make any suggestions for this study and for this presentation. So I thank you in advance. So as we are all very much familiar, the open educational resources are part of the 5 pillars of open science. And we see in the context of this research, the importance of open science and open resources and open access as well, with the magnitude it can bring to help advance and develop science quicker and in a more collaborative scenario, not only of resources, but mainly in terms of knowledge and information. So we would like to begin by bringing to your attention the new recommendations from UNESCO about OER, because we understand they are very well aligned with the recommendations we listed as a result of this research. So among these top 5 recommendations, we have the creation of high quality open educational resources, policies that support and foment the creation, use, and distribution of these resources, as well as sustainable models for its development, and the international cooperation as a very important and relevant factor for the sustainability of OER. Here we can take a quick look at the object of this study, which is the network of open educational resources from PAHO, the Red de Repositories de Recursos Educativos Abiertos. And in this context, we have listed the Mercosur countries, so Brazil, Argentina, Uruguay, and Paraguay, as the repositories we are going to have to take a quick look and actually make a quantitative and qualitative analysis as well. This network of repositories from PAHO was created to foment the search, the publication, and the sharing of open educational resources and learning objects among the countries from Latin America, not only for students and learners, but also from the point of view of educators as well. And what we would like to answer here is the question that if these repositories from PAHO are actually following the objectives and the goals from national ICT and OER policies. So to answer this question, we have developed evaluation and assessment matrix that will also serve as a tool, as an input from this research process. But why? What was our motivation to answer this question and to provide this evaluation matrix that we're gonna call a new input to help analyze and assess OER digital repositories? Because we see digital repositories as a strategy to develop an information and knowledge society, specifically in the context of Latin America. We also see this as an opportunity to help use and develop ICT, because we see the potential that these the use and the development of ICT has to minimize the digital gap and the social disparity we see within the territory. We also believe that this study can contribute by filling a gap in the studies around this theme in in information science. So we would like to help increase the knowledge production about the use of ICT in health, not only when it comes to research and healthcare management, but mainly when it comes to teaching and learning. So our main objectives with the study are to develop and provide a qualitative and quantitative analysis of the OER repositories from Mercosur within PAHO's network. We would also like to contribute with the assessment matrix as a form to study and analyze future OER digital repositories, not only that are targeting health, but also other areas of knowledge as well. We would also like to promote recommendations in order to make the initiatives around OER more relevant and create a bigger impact. And we also think it's very important to map the public policies within the region that guide the development of OER digital repositories. So in order to do so, we have followed 3 steps. First, we made a literature review where we determined the context of OER within Latin America when it also comes to open access, public policies, and ICT. We have developed this assessment matrix that we will share with you very shortly based on 2 groups of variables. The first of them came as a result of mapping the public policies for OER and ICT from each country of Mercosur. And the second group of variables was PAHO's general policies for its network of OER repository. And first of all, after the assessment matrix, we actually developed an assessment of the repositories by analyzing the data collected. So in terms of results of this research that we would like to share with you, first of all, we identified 4 main aspects that define the region itself, especially when it comes to the Mercosur countries, but also serve as a reflect of the entire region of Latin America. First of all, each country in the region faces a very difficult context when it comes to open educational resources, which causes different levels of engagement when it comes to OER. However, all of these countries see OER as a tool for collaboration, a tool for optimizing resources. And in healthcare and in open education, it serves as a tool to help make knowledge more democratic. We also see in the region the view of public policies being very important to foment OER initiatives, and they vary a lot, not only from country to country, but also how each institution engages with the public policies itself. And what we could see is that the main areas within health that were impacted by OER or that engage more when it comes to OER are public health, health education, and primary care as well. So what we can see after mapping the OER and ICT public policies throughout the countries of Latin America is that almost 50% of these countries either state they have public policies for OER in place, or they come from public funding usually, or they recognize the cost benefits of OER and also see it as an innovative tool. And over 60% of these countries state that they are motivated by the opportunities OER brings, especially for open education. In terms of the repositories from PAHO, specifically in the countries of Mercosur, which are Argentina, Brazil, Paraguay, and Uruguay, we can see a huge discrepancy in terms of number of open educational resources. Brazil itself has over 12,000 open educational resources, when Uruguay only has 5. So it has proved to be very difficult, to be a challenge, to make an analysis region-wide when we have such different levels of engagement when it comes to open educational resources. However, what we can see that these countries have in common is the target audience and the educational context and purpose of these open educational resources repositories. So to all of the Mercosur countries, the main target audience for the repositories are students, except for Brazil, where we could not identify the target audience. But what we can see is that all of them create and make these resources available for professional education. So in order to create the assessment matrix, we have divided the attributes in 2 groups of variables. The first of them are the general indicators, which were mapped from the public policies for OER and ICT from each one of the countries from Mercosur. And what we have here is the potential of use of these resources for educational purposes, the potential of use and reuse to guarantee the open licenses and the open access for these resources, the adequation of the technology infrastructure to make sure that the technology was adequate to the network's objectives. And the second group was the PAHO's indicators, which were mapped from PAHO's general policy of its network of OER repositories. So for this second group of variables, we have the quality of the resources in terms of the veracity and precision of the content and the resources itself, plus the presentation quality when it comes to design and organization of the content, followed by the usability, which includes the easiness to navigate, find, upload, and download the resources within these platforms, and the educational value when it comes to how useful are these resources for educational purposes. So what we can see after analyzing these repositories is that Brazil itself has 70 times the amount of resources from all of the other countries from Mercosur combined. And the resources from Brazil come mainly from 2 institutions, which are the Open University of the Public Health System of Brazil and Fiocruz, which is a very important research institution. And what we can see is that these 2 institutions do not have their resources in a mean that they are interoperable. So what we question is, although we see on a national level in Brazil a high adherence to OER public policies or institutional policies, are they meeting at least interoperable metadata standards? Could we have a larger number of open educational resources if this was actually being developed and taking place throughout the country if we not only had two major institutions providing, creating, and sharing and distributing OER. Second of all, we understand that even though Argentina, Paraguay, and Uruguay do not have the same level of engagement with OER as Brazil on a public institution, in an institutional level, over 60% of the users of the OER network from PAHO are from Mercosul. And over 45% of the pages visited within the network of repositories are actually the repositories from Argentina, Paraguay, and Uruguay. So even though we see that Brazil has a much larger number of open educational resources, we also have users from the three other countries from Mercosur being very much engaged with PAHO's repositories network. What we also would like to question, instead of bringing an answer, is the necessity to actually create a new network of repositories from scratch. Could we only create a platform that integrated all of these resources already available national-wide or institutional-wide? Could we create processes of metadata interoperability and integration of these already existing resources and not actually having to create a new network from zero? We also understood in this context of Latin America that these repositories work as mediators because they condense all of the educational demands from healthcare professionals, educators, and learners as well. So they work as a channel between the public policies and the people who develop these public policies and the final users itself. So we ask, are they aligned? Are the public policies following the needs from the final users? Are the repositories actually meeting the educational demands from the final users? And what we understand from that is that we need to overcome the need to provide technical infrastructure, but advance in digital literacy. So we need to create possibilities for learners and educators to actually have their digital needs, to develop their digital needs in a more adequate and profound way. So when it comes to this understanding, we need to focus on educators and motivate educators either within policies institutionally or national-wide to make them motivated to create and develop open educational resources, because we see the educators as advocates for OER within this context. We also understand that open access plays a very important role, and we see it as an ally to the democratization of educational materials, not only when it comes to health education, but also open education in general within the region. So in order to do so, we need to secure digital open access materials and open license within repositories so the users are free to actually use, reuse, distribute, and redistribute these resources. So we need to create materials and workshops and training activities to actually be able to promote this level of understanding and knowledge around open licenses. Finally, we understand the public policies as a solution to make the OER initiatives and models sustainable within the region, because they are able to understand the local needs for each country and each context specifically, but also be integrated with the demands that the region presents. So we need to be able to provide training and infrastructure at the same time. Think about digital literacy and technology infrastructure at the same time. So we can actually be able to foment a regional analysis and not only an individual national analysis in order to bring sustainability for this entire process. So what we have here is a list of recommendations that are very aligned with UNESCO's new recommendations, where we see OER digital repositories as a source of access to knowledge in a more democratic way. But in order to do so, we need to have training capabilities. We need to be able to provide digital literacy initiatives for educators and learners, language workshops, because in Latin America we have Spanish and Portuguese being spoken. And specifically, we need to be able to provide training around metadata and open licenses as well. We also need to create strong institutional partnerships in order to provide promoting campaigns, exchange programs, and the development of OER between institutions, so we can actually help increase the awareness of OER and the importance of strategies within the area. And we also need to create in parallel policies that help motivate those engaged with OER, either they being educators or learners as well. And finally, we need to understand the importance of permanent and continued education in order to implement OER initiatives within the workflow and study process of these healthcare workers and students as well. So to finalize our presentation, I would like to use the model presented by NOSEC, because we understand that in order to change the OER perspective within Latin America, we need to change the culture. So in order to change the culture, we need to make OER possible through infrastructure, rewarding through user experience and interface, normative throughout the development of a sense of community within this area, easy through incentives, and required through policies. So I would like to thank you once again for your time and for the opportunity of sharing the results of our research with you. I really appreciate this opportunity, and I would like to leave you with my contact information again in case you would like to make any suggestions or take any questions. Thank you so much.